For those of you meeting me for the first time, I am Dawn, also known as That Mom of Four. Yes, I do have 4 daughters. I'm a wellness coach and I'm also an entrepreneur. And in a while, I'm going to be introducing you guys to our panelists, our speakers, as well as our expert, our National Infertility Awareness Week, right? So very timely. Okay, we do have some experts who are going to be talking a little bit more about that for you. Okay, well, for you to understand, right? The reason why you're here for this topic is because you're very interested in getting pregnant, again, what's involved in making it an easier or smoother journey for you, right? So we're going to dive into the topic of getting pregnant 101. Are you working hard or smart? Okay, so we do have our Dr. Janice Tung here today, who's going to be shedding a light. For those of you who want to understand more in the scientific realm or just like more technical aspect, we have Dr. Janice Tung, who is going to explain a little bit more in depth with well, her expertise. Okay, so she is a consultant obstetrician and gynecologist, accredited IVF specialist, well, with Singapore and the UK, and is currently a member of the Royal College of Obstetrics and Gynecology from the UK. She's got her medical degree from the NUS, where she received the SS Ratnam Book Prize by the ONG Society of Singapore for coming up top in her cohort, wow, in obstetrics and gynecology, right? So we'll have Dr. Janice Tung going through a lot of in-depth insight into getting pregnant 101, right? But I also want to introduce a couple of our speakers here today, all right? So we also have, all right, Angie Hermann, all right? She's an IVF mom who delivered, was it delivered or expected at 40? Well, I'll let her tell you more about that later. Okay, so it doesn't look that age anyway, right? Looks like an
Thank
angel.
you.
Yeah, you do look like an angel today when you guys see her later. Okay, so yeah, and that was after 8 years of trying, right, Angie?
Yes, it was. It was after 8 years. So I actually conceived him, you're right, at 40. Yes. So I am an IVF mom. Thank you so much, Dawn, of a 3-year-old that I had at 40. This was after 8 years of trying to conceive after I got married, and trying it was. My husband and I won't ever forget that journey that we took. I had an ectopic pregnancy. I lost my left tube, multiple miscarriages. And as a type 2 diabetic with unexplained infertility, we pretty much had the doors closed to us over and over, whether it was private or government. We pretty much gave up, resigned to our fate that, you know what, maybe it's just going to be the 2 of us, until someone gave us that chance, that hope to keep trying. And I must say, infertility can be very lonely, very uncertain, very dark. At least it was for me. But now there are tools, technologies, resources, and support groups like Fertility Support SG that can help many of us going through this journey. So I hope with platforms like this, thanks so much, MediaCorp and the Asian Parent for doing this and inviting Fifi and myself. I hope we can start to normalize the conversations with friends, family, colleagues, and our children in future, you know, about infertility and even loss.
Thank you, Angie. You know, a picture speaks 1,000 words, and you've got all these photos here to share with us. I've never gone through IVF, but I almost did, and I know it's you know, when people see pictures of happy families, they never think about, you know, sometimes the tough journey that often leads to that. And I'm looking forward to hearing more from you and Fifi as well. Okay, about
Thank you.
Thank you. So yes, we also have Rafidah Jalill, who is an IVF mom of 3. She did her first IVF, was it, Fifi? First IVF at 31 years old?
Yeah, it was, I didn't expect to need to do IVF at such a young age, but we were trying, and because my husband was diagnosed with male infertility, we were told, okay, the best chance you have is to just go straight to IVF. So we've done 4 cycles. We've been very lucky because we now have a 6-year-old son and a pair of 3-year-old twins. And I'm actually currently on my 5th IVF cycle. I'm not sure if I'm a glutton for misery, but we have decided, okay, let's just try to freeze some more embryos in case we want to grow our family further.
Oh, thank you, Fifi. And, you know, like I was mentioning earlier, it's actually the National Infertility Awareness Week. And you're also the founder of the FSS.
Yeah, so I'm actually leading the campaign this year. The founders are two ladies, Shumin as well as Kim. So FSS was actually, Fertility Support Singapore was actually founded in 2020. And we are 100% run by women in Singapore who have gone or are going through infertility journeys ourselves. So our main aim, like what Angie mentioned just now, is to really just help to do whatever it takes to make sure that any woman, man, or couple, they feel a lot less alone in this journey. And it's just coincidental that this week we are actually celebrating the National Infertility Awareness Week. So we are actually running a video campaign whereby we showcase people from different backgrounds, different infertility journeys, and it's actually live on our Instagram page. So if anyone wants to check it out, you can check us out as fertilitysupport.sg.
Well, thank you so much for sharing that, Fifi. All right, so I just want to point out first, like if you guys can see all of us, you will notice that myself, Fifi, as well as Angie, we are dressed as angels to support our Charlie, who is Dr. Janice. Okay, so Dr. Janice is going to take the lead to kind of give you guys a lot more insight about getting pregnant 101. Okay, and then we'll play a supportive role at the end when we go for the panel discussion.
Thank you for the invitation, and yes, thank you everyone who is attending this as session, even though it's a late Monday night. I will try to be as helpful as possible. Okay, so essentially we'll be highlighting about the science behind getting pregnant and why is it sometimes so difficult and what are some of the things we can do to help. Basically, the first part of this talk is going to sound really negative because it's going to highlight how inefficient our natural human fertility system is really. The average chances to naturally conceive in a given month by a mother essentially will decline with age. But what many people do not know is that even at age 25, your chances of conceiving in a given month is not very high. It's about 1 in 4 to 1 in 5. And which is the reason why cumulatively you do get pregnant, but it takes time. So you have to give yourself 6 months to a year to try. So, and of course, the older you are, the longer it may take for you to get pregnant because of this. Why is this so, you may ask? I still can't control, sorry. I can't. Okay, now I can. Okay, all right. So, the reason for this is because, first of all, our human fertility has the system so tightly controlled that only 1 egg is released every month. So this single egg comes out of the ovary and hopefully goes to the tube. And with 1 egg, of course, you only have 1 chance in 1 month. And then what makes it even more difficult is that this window where it comes out is uncertain. People with regular cycles, yes, may have a so-called predictable ovulation window to try, but that ovulation window may vary from cycle to cycle, and it also can be affected by many things like work stress, infection, illness, anything at all in general. And I'm sure some of you may have gone through this, like temperature taking, measuring, and taking pictures of all your ovulation test strip and sticking it in the book, and all these very, very tedious methods to try and detect your ovulation window reliably. And only to be told when you arrive at the fertility consult room with your doctor that these methods are not so reliable, even though you have done so much homework in them. So it can be quite frustrating. And of course, then there are those delayed cycles where you've been having regular cycles like on the dot, and then suddenly you miss your menses by 5 days to a week, and you think, this may be it. But then you take your pregnancy test and it's a negative, and that is, the hope all just comes crashing down. So, I'm sure many of you may have gone through this and can understand the frustrations behind this.
Yeah. Okay. And I rewind a short while because it's very intriguing for me, because I do track, not that I still want any more kids, but I actually do track my ovulation because family planning, right? Enough already for. So But for those who are thinking of getting pregnant, yeah, you have that chart there where they're tracking their temperature and their period cycles, right? So now with technology being so advanced, there are actually like smart devices like the watch and the phone where you can actually, match your body temperature. Like my Apple Watch actually tracks my body temperature at night when I'm sleeping, and then it kind of pulls out the data from what I put in for my cycle tracking as well. So when my period started. So is this very accurate? And would you actually recommend your patients to track it that way?
Generally, I do not recommend such methods to track ovulation, because one of the things about them is that they tend to detect ovulation a bit too late. So it's by the time it detects that it's positive and then you try, it's often a little bit too late. The window is missed. So that's one. And two, it becomes very stressful and very tiring and tedious to check. So I would prefer that they do not give themselves additional stress by doing so.
Thank you.
Okay, so yeah, moving on. Then yes, what else makes it more difficult? So basically, one egg coming out, but you basically need a lot of sperm in order for natural fertilization to occur. Why this is so, we have no idea, but this has, our body system has been made like this. So I mean, if you want to compare it, basically you need an entire army of soldiers to lay siege to the castle, but only one person to assassinate the queen. Okay, so that's the way it is made. So this means that if you have you don't have an army of soldiers, it can make it very difficult. So that's one other point. And then if, let's say, after everything is done and you have fertilization, the embryo that's formed has to implant in the womb lining, the endometrium, the cavity. And this is where, let's just use this comparison with the seed and the soil, okay, where you may have the seed and it may be a good seed, but you will need the soil to be suitable for implantation and growth of that seed at that moment. So this sometimes doesn't happen. So there's another whole factor involved in what houses this embryo. Okay, so this is what makes everything so much more difficult in the natural fertility system. And then on top of this, the natural system is subject to the law of diminishing returns. So basically, as you age, the quality of your eggs drop, your egg count also drops. So what does this mean? Essentially, when quality drops, it means that you will need more eggs to possibly have a good egg that can result in a pregnancy, and a successful one at that. Which means that if you look at this black chart here, if you're under 35, 6 eggs may give you a more than 50% chance of what we call a estimated live birth rate. So that's what ELBR stands for. And live birth we will consider that a successful pregnancy. So, and then if you look at someone over 40, you may need 20 eggs for that percentage, for that chance. So you can see the drop in egg quality affecting this. And the worst thing is, will we be able to get 20 eggs in a lady over 40? Really, the answer is unlikely, because the egg count will drop with age and time as well, because it's a function of the ovary, and the ovary is programmed to decline in its function until you menopause. So we don't know, again, understand why the human system is made this way, but it is. And that's our natural system is subject to this law of diminishing returns. So how? Okay, so I mean, whenever we mention all these things, then women get very stressed. They say we have a biological clock, right? It is ticking away, we are going downhill, even from age 30, we're going downhill. So I mean, there have been groups who will advocate, that, come on, you need to tell women to stop thinking that their biological clock is ticking. Yes, a 40-year-old should be able to get pregnant as well. A 45-year-old should be able to get pregnant. In order to empower women, to think that, they can have their reproductive choices in life. which is both true and false as well. So the fact is, it is more difficult at age 40 and 45. But however, it is true that you can still get pregnant. There's always a chance in that natural cycle that one egg coming out is the one. Yeah, but you have to understand realistically that your chances will go down, okay, with age. And the other thing is also to not be hoodwinked into the thinking that if you're under a certain age threshold, like say 25, 26, 28, or even under 30, 29, that you are in no danger of this issue of biological clock, because there are some, I mean, I wouldn't say that the majority of young women have a good egg count, have good egg quality, but there is a portion of ladies at this age with a low egg count to begin with, as well as low egg quality, even though that is not measurable. So in such instances, this entire thing about biological clock ticking away at an older age is going to be false, because for them, it is already ticking away when they are young.
Yeah,
So,
I think
yeah,
the fertility check that we were.
yes,
talking
correct.
about.
So your whatever is applicable to your case and your condition is not going to be applicable to somebody else. So general statements like this needs to be done away with in a way. Yes. Okay, so on top of this natural system, to make matters worse, there's a lot of other things that can happen which will affect your chances of naturally conceiving as well. So, I mean, this includes any number of lifestyle factors, including work stress, your weight, management, smoking, caffeine consumption, infections. In this case, I'm referring to sexually transmitted infections in some, and other I would go on to the other non-fertility related issues, so such as serious medical diagnosis like diabetes, for instance, in Angie's case, mental health issues, your socioeconomic situation. All these things can contribute to how difficult it is to try and get pregnant. And then you have hormonal disorders, which means that you don't ovulate. That means that the tightly controlled system where one egg comes out doesn't even happen. You don't even have an egg coming out. And then there's other issues with the ovaries, such as cysts that might affect your egg count and egg quality, endometriosis. The womb can have structural issues like fibroids, polyps, all these things, and the tubes can be blocked as well. So I don't really want to go into this individual things, because I mean, when it's not applicable to everybody. You get what I mean? Your case, when you discuss it with your fertility specialist, some things will apply and some things will not apply. So that's why it is important for you to get a fertility health check. Yeah. Now, then we talk about how when we are finally pregnant, you still have other problems, because we're looking at successful pregnancy, not just any pregnancy. So you have conditions where you're pregnant, but not actually pregnant, you know, where you have a pregnancy health test that's positive, you do your blood test, it shows that you're pregnant, but the blood test does not rise very well, or it goes off after a while and there's never really a pregnancy seen. So that's a biochemical pregnancy. And then you can also have issues where you have a blighted ovum, where the pregnancy sac does not actually have an embryo inside, and it's early, basically the pregnancy has stopped developing very early on. And then you have miscarriages. I mean, this cartoon animation film really highlighted it very well. Yeah, it's a very touching film, okay, about the experiencing loss. And then you have ectopic pregnancy, which I mean, yeah, I think you'll share your experience later. Essentially, yeah, which is another problem where the pregnancy is not even inside the womb, it's outside, and it cannot be allowed to grow outside, and you actually need to remove this pregnancy or resolve it in a way. So all this makes it very difficult. And then there's even more problems with the amount of information outside, you know, forums, everything, well-meaning advice from friends, family, and elders, which may or may not be useful. And then just even in print alone, there can be so many books. Okay, I think people who have been trying to conceive with very long journeys would have probably read a lot of these things. Okay, And those who haven't, don't panic. I haven't read all the books myself. Okay, so
yeah, our expert is here, so y'all please don't go and anyhow read.
yeah. So the thing is, yeah, it's not a problem to research into it. In fact, it may be helpful, but also information overload is not good. Okay, this is where your doctor should help you, basically, because we have the medical background and the knowledge, and we know what to sieve out that is not so useful, what is useful, and to actually consolidate the evidence for you. So that's why we are here. Okay, so you'll find yourself walking along a tightrope, I would say, basically, where you're trying your best to stay calm and to relax, because everyone says, come on, just relax, otherwise you're not going to get pregnant, or relax and then it will happen. Okay, so you're trying to do that, but then at the same time, it doesn't happen. You don't just relax and get pregnant also. You do need information, you do need knowledge, you do need to know what you're doing, and have a comprehensive discussion with your doctor about the next steps, how to utilize the technology and all that to help yourself. Okay, so it has to be a fine balance, which is the reason why I would say that a lot of ladies, especially those undergoing IVF, not just those trying to get pregnant, of course, they find themselves in this very tense and stressful situation because they're literally walking a tightrope.
It's true. And then if you guys have questions in the meantime, please don't forget, there's a Q&A box. So, at the end, we will have a discussion. If your questions are picked from our team, it's actually from the Q&A box, all right? So questions, just put it there, okay? Thank you.
Okay, so what I'm trying to say here is that, therefore, even though you should try to stay calm as far as possible, you do need information. You do need to know where you are in your journey and how to make use or capitalize on your consult with the doctor. Okay, so in order to put things in perspective, often this is the journey while you are trying to be parents. Okay, you start off with a fertility health check. It can be any point along this. It can be repetitive as well. Some people go from clinic to clinic and then get repeated fertility health checks. I do not really advise this, but the idea is this fertility health check can be done at any point or repeated at any point. And of course, you can go from no plans as yet when you're younger. And then if you're less than 35 years of age at this moment, egg freezing is becoming a possible option. And then you can go on to have a fertility health check, find that you're not ovulating, and then be asked to do some ovulation induction cycles where you're given medication to induce ovulation. Okay, you can continue to try naturally for some. And then surgery may be helpful in some cases. And then all this is, of course, interlinked with some other cycles of assisted reproduction treatment. So like SOIUI cycles or IVF. I will highlight a little bit about this later on. But the idea is everyone is somewhere along this cycle. Okay, and then finally with IVF being the so-called final resort where everyone goes to. And that is often because of age, where time is sort of running out in a way, and you have to utilize IVF in order to accelerate your means of trying. Okay, and then there will be some, of course, where you may be asked to consider donor gametes, either donor sperm or donor eggs from other people who have, because of some very inherent issues with your egg or sperm. And adoption, of course, is an option. Okay, so as I mentioned, this fertility health check is very important. It can be done at any one point of time, but we would advise that you get it done early, at any point where you think that you may want to have a child, or even when you just get married or before getting married. It's not a bad thing to get a fertility health check done, because early detection of any problems will help you to save time, and time is of the essence in fertility. Okay.
Yeah, I think that's
so. when you do a fertility health check, even just simple advice from the doctor regarding some ways to restore your natural fertility or optimize your natural chances would help. So that includes lifestyle modifications, cutting down smoking, caffeine consumption, weight management, okay, as well as taking some supplements, which might be useful in fertility, such as vitamin D. For a fact, Asians are deficient in vitamin D. Don't think that the exposure to sunlight is of any use at all. It's actually not. We are actually not exposed to sunlight as much as we are supposed to, okay? And yeah, any antioxidant supplements to help with protecting the egg quality, controlling or stabilizing all other medical issues, okay? As well as ovulation induction. So when you are not ovulating, there are medications that we can help to induce ovulation and therefore restore your natural chances with ovulation. Okay, and surgery to correct issues such as fibroids and other things. Okay, so ovulation induction, as I mentioned, has to be used along with time love making, and therein lies the difficulty. Okay, the problem with time love making, as anyone who knows who have scheduled making sex or it's very difficult. So sex doesn't always work out the way we want it to. So generally, when patients come to me, I often give them a practical solution, some fallback plan, okay, which is this thing called turkey buster method. I won't go into the specifics of that. You can discuss that with your doctor. But the idea is they need a fallback plan in order to take away the stress of baby making. Yeah, and so that they can have sex when they want to, and then they can have other ways of trying if they don't feel like it. Okay, so usually I would say that it's a useful practice to confirm ovulation either via scanning or blood tests. Blood test being the most reliable way, but the blood test is done retrospectively. Okay, and then surgery, as I mentioned, can help to deal with things like fibroids. So fibroids, not all fibroids need to be removed. Again, I think generalized statements on the internet and all this needs to be done with, because it all depends on where your fibroid is, the size of it. Okay, as you can see, a fibroid in the cavity will obviously have a lot more impact than a fibroid outside the womb. Endometriosis, surgery can help to ablate or remove these endometriosis, okay, which may be causing scarring and distortion of the anatomy of the tubes and ovaries, such that the egg that's coming out of the ovary cannot reach the tube. Okay, so surgery can help to deal with that. Unfortunately, for adenomyosis, where there's endometriosis within the wall of the womb, that is a difficult situation because often it requires hormonal treatment rather than surgery, because surgery is not going to be able to excise all that within the wall of the womb as well. But so this one, you have to discuss with your doctor regarding this condition. Yeah, so but surgery is useful in other things. And then there is also polyps, where there's this little growth in the womb lining, as you can see in this picture, and a scope is done and introduced into the cavity to see the polyp as well as to remove it after that. So beyond all these ways to restore natural fertility, we look at ways to augment natural fertility. As I mentioned to you, the natural fertility system is highly inefficient. So what can we do to try and make it more efficient? So we do what we call SOIUI cycles, or supraovulation intrauterine insemination. A mouthful, but what it basically means is that we're going to stimulate the ovaries to get more than one egg out, okay? Maybe 3 or 4. And then we do a timed ovulation with a trigger injection. We can see on the scan that the eggs are ready, and then we go ahead with the trigger injection to make sure ovulation happens. And then after that, we get the sperm from the husband, and then we get it, we concentrate it to the fastest moving soldiers, and then we will put in the soldiers in the womb cavity, very much nearer where it's supposed to be. And the moment we flush it through, we maximize the concentration of sperm around the egg at the time of ovulation. And so in the hopes that in this way, natural fertilization occurs. Okay, so this can help to augment the natural fertility. And then we have IVF, which, as I mentioned, remains the most efficient method of trying. Okay, it's not a guarantee, but it is certainly the most efficient. Okay, the thing is, it's what happens is that we try to give you more injections to stimulate as many eggs as possible. And unfortunately, we are limited by your egg count per se, which means your ovarian reserves, the ovarian function, which is the reason why time is so important. Eggs are extracted from the woman's ovaries, and then we fertilize it in the lab with the man's sperm. Okay, in this modern age, almost all cycles are done via sperm injection, meaning we take one sperm and we inject it directly into the egg, because this gives us the highest fertilization rates, like 80 to 90%. If we put the eggs on a dish surrounded by sperm, fertilization rates can be as low as 50% only. So that is not very helpful, right? The whole idea, yeah, correct. The whole idea of technology is to make things as efficient as possible. Okay, so after all that, unfortunately, many people stumble at the final step where you have the embryos, which is a combination of your egg and sperm, and then we put it into the soil and it doesn't take. So there are many factors, okay, why this is so. I mean, from all the studies and the literature and everything, the main factor is still the embryo. The seed is not good enough, okay? This is, I mean, from everything that's been shown and from our experience also, it is the predominant factor. And then there are other things, of course, related to the soil. Immune factors, your body, the embryo is it's half foreign to you. So your body's immune system is not going to like it, okay? So in fact, a woman's womb is actually very hostile to embryos. Okay, so yeah, and then there will be some who have additional immune issues that make it even worse, even more hostile. Okay, then there's people with clotting problems, where the embryo, because for the embryo to take, it needs to form blood vessels into the lining, and then implantation needs to take place, placenta needs to form. And so people with some clotting disorders, this may not happen very well. And then, of course, there are also some unknown endometrial factors as well, you know, growth factors, vascular factors, a lot of these little things that science has not completely understood, actually, yeah, which is the reason why it makes it difficult. So what we need to understand is that, obviously, after all that I have said, IVF is not elixir to get pregnant. If it was to create the elixir, our jobs will be even worse. It will be very, very difficult. Okay. Yeah, so our job is really to marry the science, yeah, with your case, to use the science to help you as much as possible. So IVF pregnancies, and this is the reason also why we don't ask all young ladies to go ahead with IVF. I mean, because if I told you like everything is all very inefficient in ourselves, then everyone should just do IVF from the word go, right? But IVF pregnancies themselves are heavily medicated. They can come with side effects, they come with risks. So if it's not essential or necessary, then obviously it's not for everybody. Okay, so it is used as an accelerated means of trying by bypassing natural fertilization, and your success rates always vary depending on the complexity of your case. So you know, it can be less than 10% in some cases and to more than 50%. So I'll always tell ladies that they cannot use a general success rate to determine their chances. Yeah, everything has to be according to themselves. And in itself, the IVF cycles will offer further information. Every time you do one IVF cycle, it gives you more information about your next steps and your next plans. And this is where the doctor is supposed to come in and try and help you. Yes. So the practicalities of the situation is that obviously IVF, if it's much cheaper, much more affordable, or much easier or covered by insurance, it will be a lot better and less stressful for parents. But unfortunately, it is a very, very expensive treatment to pay for a chance. There are ways that the government tries to help. So you can utilize your MediSave, which essentially is your own savings. up to a limit of $15,000 in a lifetime from one account, not both. So that is very difficult because one IVF cycle can cost as much as $18,000. So obviously this far exceeds what your MediSave is going to allow. In the public institution IVF centers, you can try with government grants, but at least one of you has to be a Singapore citizen. Okay, so that's the main problem. For 2R PR couples, that wouldn't help. Okay, and it's also limited by the number of cycles you can do. So what we find is that in the private IVF centers, we are either helping foreigners or we are dealing with very difficult cases or cases where couples who have already tried many times before and have exhausted all the government grants available.
Dr. Janice, we're going to need to rush a little
Yeah,
bit.
sure, no worries. I think I should be finishing. Okay, yeah, so you are actually paying for time. It buys you more chances over time. As I mentioned, your ovary reserve is a law of diminishing returns. And unfortunately, there will come a point when you're doing the IVF where the maximum limit that can be drawn out is almost similar to natural chance. And currently, ovarian rejuvenation is still experimental. So therefore, you need to take some of these messages home, which is the time to try is now, especially for IVF. It's not really later because of the time factor and the law of diminishing returns. And you do need some mental and financial perseverance because one cycle may not necessarily always be the one. You can take a breather, of course, reassess your options, but you should try again as far as possible. And then again, this tightrope that you're walking, do try to find a balance as far as possible. Partner support does help. Communication does help. Okay. And then again, early detection with your fertility health checks. And definitely no one size fits all approach. As I've already mentioned time and again during this whole presentation, that even the success rates is not applicable for everybody. And yes, so this is in conjunction with National Infertility Awareness Week. So yes, I do wish everybody all the best.
Yeah, thank you so much, Dr. Janice. I mean, there's so much that you have to share, and in this short
Sorry.
No. I mean, I have questions on my own as well, but you know what? There's overwhelming questions that people have shared with us. So thank you so much. We're actually gonna pick out some questions because of the essence of time. So we will just select a few, and we do have quite a number of similar questions as well, right? So one of the questions that stood out was somebody was asking that she's 34 years old, but she's only got one fallopian tube. So is there a high chance for her, or will it be really, really difficult for her to conceive? Actually, you know, this question is more for one of our speakers, Angie. Angie, you want to share?
Oh yeah, so I actually lost my left tube from my ectopic pregnancy where it ruptured. And yeah, I'm living proof that you can. So whoever this person is, I don't know your medical background, so I can't say for sure, but all I can tell you is I have one tube. I had one tube when I did IVF, and I have a 3-year-old now. So please don't give up.
Thank you for sharing that, Angie. Don't give up. Thank you. And then so we do also have some people who are asking the same questions, like, you know, they ask if weight is a factor in having difficulty in conceiving, even if her cycle is normal and all lab tests come back normal. Will weight be a big factor?
Yes, it's been shown that if you are the extremes of the weight range, so whether you're overweight or even like very underweight, like BMI of 17, it can be a factor. It will take you longer to get pregnant.
So actually maintaining a very healthy weight, not being overweight, not being underweight is actually very important. And someone also asked if caffeine consumption affects fertility.
Yeah, so out of all the dietary factors, caffeine is the only one that has like quite strong evidence to say that excessive caffeine consumption will again make it longer for you to get pregnant. So for both husband as well as wife, aside. Yeah. So generally, I tell couples to limit it to 1 cup a day because depending on the type of coffee you consume, is some will exceed the limit very easily. So if you limit it to 1 cup, you're pretty safe. But if you take 2 cups, certain types of coffee will exceed already the recommended caffeine consumption.
Thank you, doctor. Okay, this is more for Fifi. Someone shared that she tried to conceive naturally from the age of 35 till 40, but to no avail. Doesn't have any fertility problems or illnesses for both husband and wife. And so they went for IVF when she was 40 and managed to get 2 times frozen transfers, but failed. So back to trying naturally since then for 3 years now, but no good news so far. It's very demoralizing, and she feels a bit hopeless already. So there's something you can share about this?
Yeah, I think it sounds like this lady is probably facing unexplained infertility, which we really sympathize with because, you know, with infertility, there could be 1,000 reasons, but sometimes just to get that diagnosis of what is going on actually gives you a lot of comfort. So, I mean, my advice would be to try something different. I always tell our community or people who have been trying very long is that it's insanity to try something over and over again without changing anything and expecting a different result. So like what Dr. Janice said just now, if you feel that you've been with a doctor and it hasn't been going, you know, giving you what you want, try something else. And also if your doctor should be trying new things with each cycle, because with each cycle, they are able to collect more data from you. So I would say do not give up and try something, but make sure it's different to what you did the first few times.
Thank you so much, Fifi.
If I could just add, Dawn, I think, if I could just add, I think for this person, I would strongly suggest, and this is something that I didn't have access to be very honest, when I was going through it. But I strongly suggest that you speak to a lot of people like from our support group or other support groups, similar support groups, because a lot of times, especially when you're in a very in a like a washing machine and you're in tumble, right? And you're just going around and around. A lot of times people will say all kinds of advice and tell you, oh, just relax, or don't worry about it. Take your time will come. And although it comes from a very good place, we all know that these are people that love us and care about us, but it's not what you want to hear. And it becomes very paralyzing to a point that you get so tired of hearing this. And yeah, I can totally get what this person is going through. So try to speak to people. And there are many of us and many of people or ladies who are still currently going through this. So a lot of times having this voice and hearing from people that are actually going through it can help you through this difficult time and keep you going, because there are a lot. I mean, look at Fifi. Fifi is one of them, and she's still trying again. And there are a lot of people who have done, we have, people in FSS who've done 10, 15 cycles and are still trying for that miracle baby. So there are a lot of people out there.
Yeah, we never give up. And yeah,
I would sorry, I'd like to add to that as well. So yes, I mean, while I don't recommend that you jump from doctor to doctor to doctor, it is helpful. In fact, I recommend my patients sometimes to seek a second or third opinion, sometimes to just have a different perspective, because each doctor brings to you the skills and the medical knowledge, the background, which is going to be slightly different from doctor to doctor. And so your chances, the best doctor will give you the best chances, a better doctor will give you better chances in a way. Nobody can give you a guarantee, but the chance is there. So a different perspective, with a fresh perspective, can give you fresh chances.
Yeah, thank you for sharing that, Dr. Janice. Actually, the next question is for you. So hoping that you can answer this for one of our attendees. She says she went for consultation after trying for half a year, or rather, this is the husband that's asking. They went for consultation after trying for half a year. So the wife is currently 29, taking folic acid, 400 micrograms daily for 5 months. The initial pelvic ultrasound scan shows that one of the fallopian tubes has endometriosis. I'm not sure what is a chocolate cyst, about 5 to 7 cm. How will this affect their fertility? Should they remove it? Can they do IVF? And what are the chances of conceiving?
Okay. Well, I mean, it is going to be a long answer, but I mean, to just succinctly put it, endometriosis is a condition which is inflammatory. So what happens is that when it exists in the tummy, it causes inflammation. It's menstrual deposits where it's not supposed to be. It can cause scarring. And when it's evident enough to be seen on the scan as a 5 to 7 centimeter chocolate cyst, it means it's pretty severe. And what happens is that the distortion in the anatomy may be quite a lot in the tummy, and that could affect her chances. She can get her tubes checked to see whether there's any blockage, but essentially, I would suggest that given her age and the fact that she's already trying hard to get pregnant, she can consider doing surgery to remove the cyst and to check the tubes to make sure you restore the anatomy of the tubes. And then after that, trying very hard to conceive within the year of the surgery, because that will be her best chances before the endometriosis comes back, because it is a chronic condition.
Yeah.
And then in addition, dealing with the inflammation as well. Yeah.
Thank you so much, Doctor. Angie, I think the next one is for you because you never gave up as well. So someone asked or someone stated that she's going to be 44 this year and decided to just give up. What can you say?
I think I have two trains of thought because I'm 43 this year. So for me, the first thing I would ask this person is, have you tried? Because that was what made us keep going, right? Because I think what you never want to do is at 45 or 50, think back and go, oh, you know what? I should have given it a shot. So if you have not tried, I suggest try, whether it's IUI or whether it's IVF, but make sure you've tried all avenues so that when the time comes and you can embrace it and you can, accept that I did my best and maybe this is my journey. Maybe it is my story that's a different story that I have to live. And that's something that me and my husband are going through right now because we tried and we had losses when we tried for our second child. But we are at that stage right now because again, so for me, I'm 43 and I have accepted that it may, not that we're not trying, but it may be that this is what I have, which is that one child, and I'm happy with that, and I embrace that. But what I would definitely tell people who are trying or who are giving up is make sure you can live with knowing that you've tried and given it your all. You know what I mean? And like what Dr. Janice said, don't stop at one doctor. If we had stopped at the seven doctors that we saw, I wouldn't have the child that I have today.
Wow.
So see different people, get different opinions, and when you can, it's not about anyone else, it's about yourself. So make sure you can sleep and you can resolve those feelings that I have done my part and I've done and taken all avenues to make sure that we tried for this miracle.
Amazing. Thank you, Angie. I just want to share, because most of you are asking, from an older age, and you're concerned about your fertility. But something that Dr. Janice mentioned earlier is also about getting your fertility checks done earlier, right? So for myself, I had polycystic ovarian syndrome when I was younger. When I was 18, I realized that I had it because I had really irregular periods, 3 months once, 4 months once, wasn't surprising. So up to the time that I was going to get married, I got married at 21. But I really wanted kids. So I was really worried and I kept telling my mom, but my mom was like, nah, you're fine, you're just too active. So I did get a fertility check and I realized that I had PCOS, which is going to affect my fertility, right? So those who are younger here, already just go get it checked. You never know what could be manifesting, and don't just wait until it's too late. So thank you for pointing that out just now, Dr. Janice. This is for you, Fifi. All right, so somebody was asking about having the support. What type of support is most important for somebody who's undergoing IVF or while having infertility diagnosis?
That's a very good question. I would say that sometimes people think that they need to have quantity of support, but actually it's the quality over the quantity. I would always advise my friends or the people in our community, you don't have to tell the world, just tell the people that you think need to know and the people that you need that support from. So for example, for me, I only told my mom and my husband and my bosses, because those were like the key people that needed to know. And I knew that they had to support me, because if you get too out there, especially in my community, in the Malay community, you might get unnecessary stress that you did not ask for, and you might feel that you need to answer for a success or expectation of a success. So I would say that choose who you need to get those support from. Support groups like us, and there are multiple support groups in Singapore as well, is very, very useful, because we have like very specific WhatsApp groups supports. For example, if you're meeting Dr. Janice, we have a chat group for her. If you're meeting like NUH, we have a chat group for them. Or if you have certain issues, you find people in there that are going through the same thing as you, because I think a lot of us who are going through infertility, we often feel like the current group of friends or social support that we have, although they are well-meaning, like you said earlier, they might not give you that, empathy that you need. So I would say keep it close and keep it in terms of quality over quantity, and find the right type of people that you can get it from.
Quality for sure.
Yeah.
Thank you so much, Fifi. Now we do have somebody who is asking, and this is more for Dr. Janice to shed a light on. On average, how soon can we expect to start on the IVF cycle from the first appointment we get with the gynaes in private centers?
In private centers, you can start as soon as your next menses cycle. I mean, obviously you pay a premium price, so you should expect to have a timeline that is way accelerated, because as I mentioned, time is of the essence. So as long as whatever needs to be done is done within that first consult, your situation has been assessed, all the investigations that needs to be done to complete your workup, and also that you accept the advice of the doctor to start IVF, then there should be no hindrance to starting within the very next cycle for private centers.
Thank you, Dr. Janice. Okay, we do want to take a few more questions, and then because time is running out, of course, you guys know where to look for Dr. Janice, where to look for Angie. I don't know, Angie is in a FSS group.
Yes.
Yeah,
Both
and then
Fifi and I.
Support.sg.
Yeah, and then we have Rafidah as well. All right, so yeah, you guys can look for them if you do want more answers, right? So yeah, Rafidah will be at the Fertility Support SG as well, right?
Yes,
okay,
yes.
so just a few more questions. This one is more for Angie. Do you have any, or maybe Rafidah as well, do you have any tips for husbands to support their wives through their TTC journey better?
Okay, so actually FSS did a whole interview with my husband last week, so you can go and hear from his part of it. So it's a very different perspective from the men's side of it. But I think for the husband, it's so important for you to be involved. Like for me, my husband was involved in every part, and it's not because you need them, to be very honest. It's like, because we are all strong women, we are all very independent, and we are fine. We can do the jabs, we can do everything. But I think what's important is it's for the both of you, because it's two of you that are going through this journey. It's not just yours, it's his also. So it is important to get them involved, and the partner, for the husbands, get involved and don't just wait to be asked. Like for my husband, I have an amazing husband. So he actually meal prepped for me throughout, like everything. Like we did nuts, we did pomegranate juice, and he did it all himself. Amazing guy. Yes. So he was so involved. And the jab, similar. I was, because I was diabetic, right? And because of going through IVF, I had to be on insulin. So I was doing the insulin jabs. So I could have done the jabs myself, but it made a difference to have him do and perform those jabs, to be involved, so that he felt like he was part of this whole journey. So I think definitely being involved in the whole process is very important, not just going for the appointments, but definitely every step of the way it's important for the partner to be involved, and keep your wives happy, because when your wives are happy, it makes a world of a difference. Keep them happy, make sure they're laughing, make sure they're around the right people, make sure they're in a good headspace and in a good environment. Yeah, just keep them happy.
I would say like try your best not to make your wife feel like she's going through it alone. Try to be there for appointments, etc. And I would say try to find what you can complement her with. So for example, for me, I'm a very emotional person. I'm very like kanjong and everything, and I'm very bad at science. So my husband is very good at science. So he was more of like the logical thinker. So we complemented each other that way. So try to find out like, okay, what are your strengths and weaknesses, and try to work together in it together.
Lovely. Thank you, ladies. We just want to take one last question, and this is for our expert, Dr. Janice. Someone asked, does birth control affect a woman's fertility?
I just typed an answer to that. Yeah. So the short answer is no, because your fertility is expected to return to what it is after the stopping of the temporary birth control method. But if, let's say, for instance, you're taking the birth control pill for very, very, very long, then sometimes the lining can be thinned out, and it will take a lot longer for the lining to recover. And also the time that has passed while you are taking the birth control pill would also naturally have an impact on fertility, since fertility does decline with time.
Wow, thank you. I'm glad you answered that, because that would have been a lot for us to read. Thank you so much, Dr. Janice. So I'm sure there's still a lot of questions that you guys had, like we mentioned earlier, but you know where to look for our experts. And there's a lot of support that you can find out there. There's a lot of quality information that you can find out there. Just make sure that you're going to the right people, to the doctors, okay, and to the right support network as well, right? So the Singapore Parenting Festival 2023 is proudly presented to you by MediaCorp and the Asian Parent, right? So the festival is made possible for you by these key partners, our gold partners, PCS Sparkle Tots, DoMax Do Grow, Scott's, and our content partners, Mums for Life, Dads for Life, Center for Fathering, and Hoya.